Hi, I'm Deborah Pascali Bonaro, host of the Orgasmic Birth podcast. And today I am deeply honored to welcome a guest who is not only dear to me, but has made an incredible impact in my home state of New Jersey. Her dedication and vision are truly an inspiration, and I can't wait for you to share in her wisdom. Today we'll delve into the powerful history and legacy of action and activism behind 123 for Moms, a transformative movement in perinatal care. We'll also discuss the quality indicators every consumer needs to know to advocate for safe, respectful, and equitable care, and highlight the role doulas play in New Jersey's groundbreaking maternal health initiatives. Stay tuned for an inspiring and empowering conversation with an extraordinary guest. So let me introduce Jill Wadnick. She's a Lamaze childbirth educator, doula, assistant director of maternal policy and early relational health at Montclair State University. Jill is deeply involved in advancing respectful, equitable maternity care, blending consumer education and public policy. She serves on the Institute for Medicaid Innovation, National Advisory Council on Doula Services, and offers technical assistance to several community-based organizations. Jill was the community doula coordinator for Hudson Perinatal Consortium that had an innovative linkage with Early Head Start back in 2010 and other Title V initiatives. Jill has contributed to organizations like Every Mother Counts, Lamaze International. She's a mom of 3. Jill is passionate about maternal health, environmental stewardship, and the intersection of midwifery and ethnobotany. Jill, it is truly beyond an honor to have a discussion and invite you here to the podcast today.
Thank you so much, Deborah. Thank you for your legacy and your work. And this is a great conversation. Thank you for having me here.
I so am excited to share your whole journey. And I know, having known you for a long time, that some of that began with your own births. Would you be willing to just share a little glimpse into what your birth was like and what, brought you to the decisions you made on where and how to give birth?
I had very positive birth experiences, partly because and rooted in my gratitude to the midwifery model of care. And there really is a difference for consumers who are able to find the midwifery model of care, which is an evidence-based way of approaching the physiology of pregnancy, labor, birth, and the postpartum period. I should say I now have young adults and late teenagers, right? So this goes back more than 2 decades ago, really 24 years ago. There happened to be a freestanding birth center in northern New Jersey with the midwifery model of care. And I mention that because in the last 25 years, in the landscape of maternal health policy, we can't take that for granted. Birth centers are closing, unfortunately, deeply impacting rural states and communities, and then even some urban spaces as well. But at the time, I was privileged to have a birth center and the midwifery model of care that were hallmarks of what I really had been wanting to make sure that there was a synergy in my personal and professional life. And so that was the origin story.
And can you just share a little bit? What was that birth like? Your first birth and at a birth center with a midwife?
It was just, what stood out for me is that the prenatal appointments were longer and centered with communication that for me made me feel very safe and very trusted. In the end, you never know what birth asks of you. And I ultimately pushed my baby out at their affiliated hospital because birth centers are licensed. And so they have protocols to follow. and I had a posterior baby who was taking their time. And so the location changed, but the midwifery model of care did not change. And that was also really important for me because I had felt a little bit more anxious about a hospital. And I will tell you that that hospital was so fantastic, again, partly because it was the same midwives, but the lactation support and the non-separation and the things that I was looking for at a birth center. And I mentioned that because, again, like, we know that 99% of people give birth in hospitals. And so from a work perspective, my professional perspective, I really want to make sure that hospitals are mother-friendly, baby-friendly. I had such a positive hospital experience with my first. In the end, for my next two, I had intentional home births. And again, luckily, we were privileged enough to have a home birth midwife that my insurance covered. And so again, these things are still inconsistent more than 20 years later. And so wanting to make sure that every consumer can find their own instinct for where they feel safe.
Yeah. And thank you for kind of acknowledging and how even when location changes, you still had a model of care that supported you. And having had birth in basically every setting, a birth
Yes.
center, a hospital, at least you labored, and then at home, how did that impact you professionally? And how did that bring you to all that you're doing?
Mm. Um, I'm very rooted in the commitment that birth matters. It is not only a physical and physiological event, but there is so much social, emotional, spiritual, cultural dynamics that I think, again, that place of safety and security is so personal. And so that's why I don't advocate for one location. We need all locations. We need these models of care that are interdependent and making sure that they're safe transfers. If someone needs to move from a home environment to a higher level of care, I want all of those locations to be places where there's shared decision making, where there's really just a sense of accuracy, clarity, and respect. And that's a little bit, I mean, sometimes I feel like I was a unicorn with, that I got that all of the places. And it's really important to scale that with financial policies, with all of the unseen indicators that impact how maternity care is delivered in the United States.
Yeah. Thank you so much, Jill, because that leads perfect into like you are really doing an amazing job of bridging that action and policy and moving things forward. And I mentioned in the intro that you would talk a little bit about 1, 2, 3 for moms, the history and the legacy. Can you share what that is and a bit about it?
Absolutely. And I'm so glad that this will be part of what is in the ecosystem this coming January. So you may see #123 for moms. And what that identifies is January 23rd being a key moment to make Maternal Health Awareness Day. And it did start in New Jersey, and I can actually make sure that you have links so everyone can see. I'd like to amplify the Tara Hansen Foundation and the work that Mr. Hansen and his family have done. I also want to amplify the acknowledgement of our Senator Cory Booker, who made this New Jersey documentation go up to the federal level and really have a congressional acknowledgement. And so through a confluence of important media, New Jersey was very quickly put on the map through ProPublica Media years ago with an important article called "The Last Person You'd Ever Expect to Die in Childbirth," and started to document a nurse whose husband was a physician, and these highly skilled clinical expectant parents, even with all their privilege and even with their understanding of medical systems, we're still at the confluence of maternity care, which is too much too soon or too little too late. So 10 years ago, there was just this perfect storm of data, documentation, media coverage, advocacy, and loss. And even outside of those tragic losing of mothers, we also have in the United States and New Jersey a lot of near misses and a lot of racial disparities in very, very significant elements like postpartum hemorrhage. And a number of ways of building awareness really kind of came to fruition before the pandemic. In 2017 to 2018, our New Jersey Senate and Assembly started to hear, like, we need an awareness day to get more visibility. And it's kind of really easy to minimize, like, oh, building awareness. But I can tell you, building awareness in the last 8 years has absolutely paid off. We now have faith-based organizations. We now have employers. We now have libraries that do maternal health awareness events. I will actually be presenting at the Plainfield Public Library in Plainfield, New Jersey for a free event on January 25th. And that's what it's about. It's about multi-generational ways of building awareness that maternity care is everybody's business, acknowledging the deep need for improvement, and making sure that people have something concrete and specific based on where they are in their own journey as a consumer of maternity care. So hashtag 123 for moms is visibility, legislatively, structurally, interpersonally. So there's something for everybody. And it's moved beyond just one day into usually a week of celebration. And because we are the most densely populated state in New Jersey, it's now like 2 weeks. So you might see the hashtag for a lot of time coming mid-January. So be on the lookout for it.
Yeah, fantastic. And for people that are listening across the US, there are events all over now, correct?
There really are. Some of our professional organizations, like American College of Obstetricians and Gynecologists, have a hashtag 123 for Moms campaign. American College of Nurse Midwives, American Association of Birth Centers. So professional organizations in maternity care will have their own events. And so you will see it, I hope, in a number of different domains. And again, there is a federal proclamation that it is now national in scope.
Yeah. And I also want to say for people listening around the world, I remember on the first day in New Jersey, we gathered at my home. So we just invited people to have our own event. So I encourage you, wherever you are in the world, you could join in with us. And awareness and action and activism is something we need to come together everywhere on. So thank you, Jill, for sharing that and all you're doing. And we will put the links into the show notes for everyone so you can look wherever you're listening or watching below and see them. I also would love to invite you to talk about doulas in New Jersey, from your early role, right, to the incredible way that doulas are being part of many of the initiatives.
Yeah, it's interesting. And I always preface the complexity of doulas in the American culture of birth, where we absolutely need the peer support, the anticipatory guidance, the perinatal education, and all of the impacts. Doulas make a difference. And I just want to really amplify that again. Doulas really make a difference. And I do not want to put healing a broken maternity care system on the back and on the burden of doulas who are peer support. It is not doulas who are doing too much too soon or too little too late in terms of assessment, diagnostic, and how maternity care is delivered. Doulas have had to bear witness to watching obstetrical violence, to watching disrespect, to watching racism impact maternity care. And so I go into the complexity of this as a doula champion. When a hospital system wants doulas, I also want to see, are they supporting a culture of physiologic birth? Because otherwise, doulas really could become a Band-Aid on a window dressing of trauma. So I hope you can and I know you can go into that complexity with me, but I think sometimes
Yes.
if you look at the headlines, and that's what I do, I do so much maternal health policy, you can see how sometimes well-meaning media outlets link and make a conflation of doulas and other outcomes that doulas cannot be responsible for, right? So, in New Jersey, there have been some important opportunities to make sure through legislation and through, the use of our state government, especially during the pandemic, to ensure that every family can have a doula. And so a doula does not need to replace someone's spouse or partner or mother-in-law, that there is a unique and distinctive role for doulas. So that is a real win in New Jersey. I spend a lot of time also making sure that there's parity and a thriving wage for entities that want to cover doula services through state insurance, specifically through Medicaid, which can also be complex because there's state dollars and federal dollars. So Medicaid is a federal program, but it looks different state to state. So for example, we're talking today in January, and we now have Pennsylvania, South Dakota, and Washington state that are now using their state Medicaid dollars as of January 1st, 2025, for doula services for those who are, for clients who are Medicaid enrolled. So I've done a lot of really trying to synthesize and make sure that the doula workforce has parity and good, thriving support. And we have a way to go in New Jersey, but what we have is really strong relationships. We don't have the highest rate the way that Washington State and California are models for doula and Medicaid. We have, again, awareness and interest and engagement and some really, really meaningful work that's happening.
Yeah. And thank you, Jill, for really giving that lay out there. And I have to say, you did a webinar recently that was so phenomenal. Even as a doula trying to follow, I didn't know how much and how the lay of the land looked for doulas and Medicaid reimbursement and the different things. Is it okay if we put that link in?
Oh, absolutely. Thank you. That's something that, and again, I want people to really make sure that they know how to find these resources. So thank you so much for sharing that. That would be fine.
Yeah. So any doulas out there, but also parents who are wondering, are doulas covered? And parents, we can use your advocacy and voice as well in all these issues. So we will add that link in as well. But I know that you also, and part of this is part of the doula's role to help in it, but it's also just a general statement to talk about, how can we advocate for quality maternity care so that every person feels safe, respected, and receives equitable care? What are some of the things that you would, talk about, especially for consumers to be aware of in this?
Well, I wish I had an easy response to this. I feel collectively this is our global life's work through the work you do at ICI, through Lamaze International. There's so many points of interest on this specific question, Deborah. I'm going to tell you something that happened in New Jersey that's very meaningful. And I would be curious for those who are in other states and other countries to listen and learn are there other mechanisms? One of your former state senators who is retired, State Senator Loretta Weinberg, was really instrumental in 2017 of getting a law passed in New Jersey called the New Jersey Maternity Care Report Card. And this became a consumer report card that for the first time, and it was implemented, usually when a law is passed, usually it's like 12 months for implementation. So when it launched in 2018, it for the first time gave a public-facing website that looked at indicators of quality. What's the episiotomy rate at each of our birthing facilities in New Jersey? What's the low-risk cesarean birth rate? What's their regular cesarean birth rate? Is there a lactation consultant available? What's the vaginal birth after cesarean rate? So all of these, there's a couple of indicators that consumers can start to look at. And also in New Jersey, we have community maternity care at some hospitals, which are wonderful. But if someone, God forbid, goes into preterm labor at 27 weeks, we would want to make sure that they're at the more appropriate level, like a perinatal regional center. And so the maternity care report card will kind of map out for our 48 hospitals and our birth centers what the maternity level of care is, what the quality indicators are like. And that is a tool that still needs some work because there's a backlog in data, right? So right now, all I could show you as a consumer is 2022 data. And then we will soon get 2023 data. So there is in public health and epidemiology this delay in real-time data, but it really does help. I was doing labor support 2 months ago at a birthing facility that has a 19% episiotomy rate. And you could see, I was at St. Mary's in Passaic, New Jersey, and you could see if the consumer had the opportunity to birth about 5 miles away, there's a hospital that has an episiotomy rate of 4%. And so this variability is a real issue, I think, for consumer advocacy to understand what is a best practice and are consumers able to find it. And this isn't just for labor, this is for life, right? So like in any medical experience that you're getting, so these are tools that I think if you start looking at quality indicators in pregnancy, you can use it as a parent. You can use it in pediatric care if your child needs special services, et cetera. And so that New Jersey Maternity Care Report Card, which only happened because of a law, it happened because women were elected into our state Senate and Assembly and really were willing to take on maternity care issues. And there's still a lot of New Jersey legislation happening, but that one in particular, I think made the biggest difference for transparency and accountability.
Yeah. And thank you, Jill, because New Jersey did that. There are a few other states that have something similar, but there are many places where that doesn't exist, correct?
I think so. And I think that'd be something that might be interesting to curate, maybe as part of an ongoing blog that we could get a report out of what states, countries, and regions, like how do consumers know globally what the quality indicators are? And I will say, this is where what we were able to get report on is outcome data, right? The
Right.
cesarean birth rate, the low birth rate, the preterm rate. But it's also important in terms of how maternity care is delivered during birth. I go back to the evidence-based resources of Lamaze International. And because we're talking about New Jersey, I have to bring up Dr. Judy Lothian, who passed away and who deeply impacted consumers to make sure in her role as a researcher and advocate and scholar for Lamaze International the healthy birth practices for a safe and healthy birth. And let me kind of just explain what that means.
Please.
Pushing in a non-supine position, meaning you're not mandated to give birth pushing on your back. If you want to, that's fine, but it's not going to be mandated. That you're going to have movement, freedom of movement for labor, sitting on a birth ball, being in a shower, squatting, all sorts of just physiologic movement. That's another one. Letting labor begin on its own. Again, we don't want to overutilize technology. And also, we're not going to underutilize it either. There's real appropriate, like I'm going to amplify the Preeclampsia Foundation and the March of Dimes. They give great consumer education. If there is a clinical risk, and I'll go for preeclampsia, that we would need to make sure that there's an appropriate induction of labor, we wouldn't want to deny that, right? So that's really, really helping consumers. So I always go back to the care practices of Lamaze International. And then there's also outcome indicators.
Yeah, fantastic, Jill. And yes, I'm a big fan of Lamaze 6 healthy birth practices as well. So if there's one other thing you'd want to say, listeners that may be pregnant right now or considering pregnancy, exploring birth with us, what would you want to leave them with?
Thank you for that question. I spend so much time with words and data. And so probably what I would want to leave is with wonder, with the deep connection of the placenta, as Robin Lim has called it, the Forgotten Chakra, the interconnected web. And so if you are open for insight, hearing this in your pregnancy, I would encourage you to find an opportunity to be looking at what weeds are growing in the cracks of the sidewalk as you leave your house. What tree do you see? And are you noticing birds? And what in the ecology, in the seasons and cyclical places of where the earth is? Where are you? That matters just as much as all of the advocacy and all of the best outcomes, that you feel rooted, connected, and resilient.
Such beautiful words to inspire us all. Can you share where people can find you, connect with you? What are the places that you are
Yeah,
publicly
so
facing?
I have an old website. Anyone would like to help me revise it, I'm open for help. And that is www.jillwodnick.com, JILLWODNICK.com. And I have an Instagram, which is at Speaking of Birth. And I do post a lot of nature, and I post a lot of recipes, but I really do try and post a lot of consumer resources for high value, respectful, and equitable maternity care. And you can also
Thank
find me
you.
on LinkedIn.
Yes, definitely good one. So those are all in the show notes as well. And I want to thank you so much. And to all our listeners, we hope that you'll join us in January, on January 23rd, in any way that you're taking a moment to join an event, to just sit down and spend some time thinking about your own advocacy and activism and your own birth for those of you that are pregnant. And we always love to hear from you. So please either tag Jill and I, let us know if you're at an event or what you're brewing or what you're thinking. And we thank you again for joining us today. Thank
Thank you
you.
so much, Deborah. Bye-bye, everyone.
Bye, everyone. We hope to see you next week on the next episode of the Orgasmic Birth Podcast.